everyone. I'm Barbara Ham-Lee. Just before the coronavirus pandemic, the unemployment rate for African Americans was 5.8%, the lowest in years. But that was then. The pandemic shut down the economy, and millions have lost their jobs. Overall unemployment is at 14%, and for blacks, it's a whopping 16.7%. And it's even higher for Latinos. Economic disparity rears its ugly head in black and brown communities yet again. And the road to recovery will be long and it will be painful. Up next on Another View, bouncing back from the economic downturn with Dr. Eric Claville. Stay tuned. Another View is next, right after this news from NPR.
Discussing today's topics from an African American perspective, this is Another View.
Hello, everyone, and welcome to Another View. I'm Barbara Ham-Lee. Before we get started with our show today, I want to take a moment to tell you about a little bit of the behind-the-scenes things that happen here at Another View, and I want to talk about Dr. Barry Graham. Now, Dr. Graham, as you know, or Barry, you hear him Monday through Friday. He's the afternoon or the daytime announcer, so he guides you through the day on WHRV. And then on Sunday nights at 9 o'clock, he brings you the Acoustic Highway, which is bluegrass folk music, and where you get a lot of guitar and banjo and music such as that. But he also is a huge, huge fan of Another View, which we really, really appreciate. And every week, Dr. Graham brings us homemade goodies. Now, today it was a strawberry and cream pie with a graham cracker type crust to it, and it was just fabulous. So we just want to say thank you, Dr. Barry Graham, for the goodies, but mainly for supporting us here at Another View. As a matter of fact, he even comes in and answers our phones. So when you call in at 440-2665 or 1-800-940-2240 to talk with our guests, you will be talking with Dr. Barry Graham. So today we're going to be talking about the coronavirus pandemic and the economy. That'll happen in just a moment. But first we want to invite welcome to Another View, Gina Harris. She is with the Census 2020 Complete Count Commission in the city of Portsmouth. Hi, Gina. How you doing?
Well, hello. How are you? I'm well, thank you.
Good. So what is going on in Portsmouth? I know you guys are starting a new or yet another campaign to really get people to sign up for the census. What's happening there?
Well, currently we have launched our Census Self-Response Challenge. So what our goal is to have citizens complete the 2020 census, and it's actually a challenge between the neighborhoods and the census tracts within the cities to see who will have the highest response rate.
And what do they get if they win?
Well, there is some incentive attached to that. We are in the process of securing some prizes to distribute to persons in the highest responding census tract.
Okay, but what does
the city...
I was going to say, what does the city get if people participate in the census? Why is this so critical?
Well, it's so critical because funding is attached to census responses. And the funding is used for schools, roads, hospitals, infrastructure, important programs such as WIC, SNAP benefits, Health Head Start, child care, and Medicaid, and because Portsmouth has a poverty rate of almost 18%, these funds are critical for our city.
Absolutely. And are you having trouble in certain communities in terms of getting information?
Yes, we are looking daily at the various census tracts, and there are about 12 census tracts that we are really targeting to complete the census.
What can you tell us what they are? Or give us a
Which
general
community?
sense? Yeah. In other words, are you looking at minority communities, homeless, things like that? Is that where the problem is in terms of getting a response?
Yes, some of the lower income neighborhoods and communities. But because those census tracts are spread out throughout the city, we are using all methods we can to include persons and to tell them the importance of completing the census. It only takes about 5 minutes to complete, so, it's so important.
And how has the pandemic affected your ability to reach out and to convince people to participate?
Well, our Complete Count Commission in Portsmouth has been active since last year in terms of trying to help us get the word out to our citizens about the census. But we have been using our social media through the city of Portsmouth, our Facebook and Twitter and Nextdoor accounts to help promote the census. We've asked the commissioners to use ideas such as a phone tree for them to actually reach out to 20 or so family members or friends to tell them about the census, and for those 20 people to reach another 20. So it's a blossoming effort.
Okay, what's the deadline? What's the deadline for the census to be completed?
Well, the deadline has been changed because of the pandemic. We are looking to have all of our responses in by October the 31st, before the census takers actually go out into the communities.
Okay. All right. So is there a website or a phone number you'd like people to call if they need more information?
Sure. The phone number is 1-844-330-2020. That's the call-in number. And persons can complete the census online at my2020census.gov.
Okay. All right. And even though you're in Portsmouth, you're encouraging everybody throughout Hampton Roads and Eastern Virginia, make sure you fill out the census. Thank you so much. That's Gina Harris with the city of Portsmouth. So President Trump is quoted as saying, "Nobody has done more for Black people than I have. Nobody has done more," in reference to the record low unemployment rate for African Americans prior to the onset of the coronavirus pandemic. Now, unemployment has skyrocketed for the nation, and Black and brown communities are being hit the hardest. Here with some perspective is Dr. Eric Claville, political analyst, attorney, and director of the Center for African American Public Policy at Norfolk State University. How are you, Dr. Claville?
Very well. How are you, Barbara?
I'm doing great. It's good to hear your voice again. And I know we keep in touch over a lot of these issues that are going on. But the economics in terms of hitting our community, we were challenged last week with a listener who said that we were bringing race into an issue that was not a racial issue. However, you even found some folks in boardrooms where we normally don't sit who were talking about the disparity between the economic situations between Black and brown communities and the white community. Is that not right?
Correct. As a matter of fact, to the issue of whether race and income is an issue as it relates to the pandemic that we're in right now, and of course, my heart goes out to everyone that's lost a loved one or those that are suffering from the virus, and we pray that you get better, and those families as well, that they're able to handle the issues with their loved one. But from the White House to the CDC to every research arm for think tanks have all came to the conclusion that inequality and inequities do exist, and they are impacting African Americans and people of color more severely than any other group. As a matter of fact, when mentioning about the economic arm of it, Jamie Dimon, who is the CEO of J.P. Morgan Chase Bank, he sent out a letter to his shareholders on Tuesday. And basically what he wrote, he said that the coronavirus has given us a wake-up call and a call to action for business and government to think and act and invest for the common good and really confront the structural obstacles that have inhibited inclusive economic growth for years. Now, this is in his official letter to the shareholders of one of the largest banks in the world. As a matter of fact, he joins the ranks of Ray Dalio, who I follow quite a bit and have mentioned on this show, Mark Cuban, also others, Sheryl Sandberg, Melinda Gates from the Gates Foundation, and many others that are stating that we have these economic inequalities and structural obstacles that help to perpetuate and actually create these inequalities that we have to pay attention to and lift. As a matter of fact, they noted that low-income communities and people of color are hit the hardest, exacerbating the health and economic inequalities that are already there. And in showing this level of inequality, they note Black Americans and their obstacles that they're facing during this time of the pandemic, both in healthcare access, healthcare treatment, economics, and also education. So it's not a racial thing, but race is a reality. If you are a person of color, if you're a person of a certain income, definitely, but if you're definitely a person of color, whether you're a certain income or not, inequalities are there, and you're going to suffer or have a harder time than your white counterparts.
You know, I heard someone say that it's not race, but it is racism that is the issue, and that's what's rearing its ugly head, because we're talking about institutional mores, institutional ways of doing things that and systems that keep people from having an equal playing field in terms of trying to achieve. The economic gap was already wide before the pandemic between African American communities and others. How much wider do you anticipate it's going to get? And I mean, what would a recovery start to look like?
Okay, well,
I know it's a loaded question.
There, right?
I know that's a very loaded question. I get it. But just in terms of first of all, let's just talk about the gap and how much wider do we think it's going to become as a result of the fact that so many people have lost their jobs and so forth.
Right. Well, right now, the unemployment rate for African Americans is double than what it was prior to the pandemic. The reason for this, Barbara, is because if you look at the jobs that a lot of individuals of color and low-income individuals have, they're what you call frontline workers, okay? And they also work in industries that are hit the hardest. Hospitality, tourism, food, service, and also other service jobs. So those individuals basically were working in industries and for companies that they depend on that day-to-day work in order to get that week-to-week paycheck, whether it be tips and so forth, with tourism and the like. In addition to that, they're also the first ones to be laid off, right? Because those companies don't really have the ability to continue to pay them if they actually don't work, because they're dependent on people coming in and spending money. So that's just pretty much a nature of the beast, a reality of what type of jobs individuals actually have. Now, where that becomes an issue is that moving forward, those jobs are not coming back. A lot of them are not. Right now, a lot of businesses that try to do the Paycheck Protection Program, they're basically stating that they don't know if they can really hold on if this summer does not allow them to rebound economically. So a lot of those companies, those businesses may close. And this is where all politics is local, or economics is homegrown. And if a restaurant closes, someone's been working there for X amount of years, it's going to be harder for them to find another job that they can actually work and get the same type of pay. So they'll probably have to get two more jobs. Well, the problem is that those type of jobs are simply just not there. We're finding also where chain companies or chain restaurants, for example, they're finding they can do more with less. People working smarter, right? So instead of dining in, you've increased the drive-through and the takeout, which means that you need less people, right? Because individuals are not they're actually driving through, so you're only just talking with one person, and another person is handing them their order. One person and another person is cooking it. So you end up cutting labor there. Now, this goes back to what we discussed some time back, Barbara, about artificial intelligence, the fourth industrial revolution, which is AI. And if you notice, if you've gone into a fast food restaurant, I don't know if I can mention any names on the radio, but
just say a fast food restaurant, okay?
Right. If you go into a fast food restaurant, if you notice some of the counters have been shortened. Some of the workers have been taken away from the cash registers, and you basically order on this machine. And you simply wait, and somebody hands you your food, right? So if you go into various gas stations, you could just walk in, get your items, literally scan, and you're pretty much out of there. So that's the way that the job market is going. But there is light at the end of this tunnel, because just as these jobs are floating, there are other opportunities that are opening up, especially in cyber and artificial intelligence. And keep in mind, the shipyard, Huntington Ingalls, and the defense industry is still hiring. So if individuals can take the opportunity to find what those jobs are through the workforce and labor agencies for the state and the city, and find a way to secure that certification.
Eric, let me challenge you about that for just a second, because when the Great Recession just happened, everybody trotted out all of these retraining programs, and the community colleges were inundated with people coming back, and so forth. So were people able to successfully move from a service industry type position into more of these AI positions, and it actually work?
Well, there's some mixed reviews with that, right? So you brought up a very good point. We tout these jobs that are available, but how can you access them, right? And how can you receive the certification and the retraining? Some companies do offer it, the certification and retraining, if you are hired directly through them. But there is a process that you have to go through in order to not only find the opportunity, get the certification, find a way to pay for it, and then from there actually go and secure the job through job interviews. So along the way, what ends up happening is that individuals become discouraged. Along the way, life happens because, unfortunately, because you're getting recertified, that doesn't mean that your rent or your mortgage stops. That doesn't mean that your bills stop accumulating. So you kind of start balancing, well, I have to work, or I have to put food on the table, or get the certification. So what do I do? So, and then again, when you go through the hiring process and the schooling process, that's where those structural obstacles of that block inclusiveness and racism kind of rears its ugly head again. So again, it's a mixed bag. It can be done, but is the route clear? Is it one that's not going to be without bumps? Is it one that's not going to be without individuals that are pushing against you? Absolutely not. I mean, that is going to happen. And unfortunately, until we address those obstacles, which is what Jamie Dimon was mentioning over and over again, simply is not going to get better, and a lot of people are going to just give up.
440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. We're talking with Dr. Eric Claville. He is the director of the Center for the Study of African American Public Policy at Norfolk State University, and he is talking with us about the coronavirus pandemic and the economy. Eric, there was a poll done recently by the African American Research Collaborative in collaboration with the Equity Research and Innovation Center at the Yale School of Medicine and the NAACP. And they did a national sample of 604 all African Americans. 75% was done online. 25% was on live phones to make sure that those who did not have internet had access. And they talked about a variety of issues surrounding COVID-19, but there was some major points that came out of this poll that really led to this whole issue of trust and whether or not and how that will impact the economics of this country. So 80% of those polled preferred to hold off on ending the shutdown to assure their safety ahead of boosting the economy. 64% of African Americans agreed that they were less likely than whites to be offered coronavirus COVID-19 testing, and 60% agreed that they are less likely than whites to have everything done to save their lives in the hospital. Those two facts alone, without even going into some of the other ones, the lack of trust that this country has its best interests at heart is something that is very, very real in the Black community. And so how do we balance that with when you look at things like the PPP that went to major corporations and did not really trickle down to smaller minority-owned companies and things of that nature? How do we balance that lack of trust with also trying to move forward?
Well, Barbara, it's just like any issue and problem that you have. You have to be honest with yourself first. And again, I go back to that shareholder letter because I thought that was very powerful what Jamie Dimon sent out to all the shareholders. He said, listen, I'm being very honest with everybody here. We've got some problems. We know we've got some problems because they're structural. And if we don't, this is our wake-up call. It's the same thing that we're finding during this pandemic. A lot of issues that African Americans have stated that they are experiencing as it relates to obstacles in healthcare, as it relates to racism and treatment with disparate treatment or different treatment with police enforcement. The pandemic has shown it. I mean, you cannot deny it. It is there. And it's one of those things, again, number one, you have to admit it. And I think we're coming to a point where we are looking at it right in our faces. Secondly, you have to have leaders that have courage, that can stand up and say, listen, these are our problems in our area. It has to be local, it has to be state, it has to be federal. It has to be on the national level and say, listen, we're going to take action because if we don't help every single person in our area, then we're going to do damage to ourselves as a whole.
It was interesting that in the survey, people trusted their governor and their mayor more so than they trusted the federal government.
Yeah, well, Barbara, our federal leadership has, for the last 3.5 years, right? We've seen a lot of turmoil. We've seen a lot of misinformation come from the White House through the daily tweets. One that he sent out just the other day about the Michigan rogue Secretary of State, and this is voter fraud and so forth, and then delete it. That creates fear. I mean, right now people are dying, people are afraid, and you're going to send something out like that that's not fact-based. In addition to that, a lot of infighting in our houses, the Congressional House and also the Senate, investigation after investigation, and everyone name-calling, everyone pointing fingers. But at the same time, Main Street is simply not getting better. So your local and state leaders get it. They say, listen, we live here every day. We're just not at the Capitol and go over and live, in Chevy Chase or Georgetown area and all as well. But we live in our local cities and towns, and we're part of this community. And we see the need, and we see where people need help because we're part of these people. So it's not surprising that they do trust their local leaders more so than not.
That is very interesting. 440-2665 or 1-800-940-2240. What questions do you have about the economic condition that we're in now? How do you see us coming back from this economic downturn? 440-2665 or 1-800-940-2240. And if you're just joining us, we're talking about the economic impact of the coronavirus pandemic on the African American community with Dr. Eric Claville, political analyst, attorney, and the director of the Center for African American Public Policy at Norfolk State University. So we've had several stimulus packages passed. We've had 2 so far, I think. 2, yeah. And then the HEROES Act has just been passed by the House and is at the Senate. There's some things that were put into the HEROES Act to address some of the inequities that minority communities were facing. Can you talk about some of those, Eric?
Sure. So one area that's in the new stimulus that was passed by the House. Now, keep in mind, it was passed by the House. It still has to go to the Senate, and
Right.
there's going to be a fight there. But there is a new round of stimulus payments to families under this particular new stimulus. It could go up to $3,000, I think, for the family, $2,000 a month stimulus check to qualifying individuals. The qualification has also been increased to include college students who still live at home. The first stimulus did not include college students, and that was a loophole that I thought that could have been that should have been closed because of the impact that it had upon individuals. It also includes infrastructure upgrades, fiscal support for states and local governments, payroll tax cuts, some issues through no mortgage and free rent, but also student loan forgiveness. So under this particular stimulus, we're looking at $10,000 of federal student loans forgiven and $10,000 of private student loan forgiveness. Now, this is slated to cause 16 million students to be debt-free for student loans. In addition to that, I think it falls, well, the Congressional Black Caucus stated, and I agree with the numbers, it falls a little bit short of the $40,000 for federal that's needed, especially for students of color, because the larger amount of burden that they have to take in order to graduate with a 4-year degree as opposed to their white counterparts because of the lack of help that their family can give, again, which goes back to the economics. In addition to that, well, first of all, I think that is key. You definitely need that. It also keeps student loan interest rates at 0 and suspending loan payments for the end of the year. Now, again, I think that these are some very good ideas, and there's some ideas that, keep in mind, who were called the progressive liberal arm of the Democratic Party. Everybody said they were crazy. Who's going to do this? It's going to cause, the country to go belly up, but they're doing it.
Wow.
I mean, right now, the ideas that Bernie Sanders has been talking about for decades, it's all happening right now. So whether he becomes president or not, his ideas have become the mainstay of our society right now. Now, the other part of that, Barbara, is what's called the HEROES Act. There's monies that are available for frontline workers in healthcare and public service to help them through this time period. Also, there's monies for the postal office and postal workers to help them as well. Keep in mind that the post office is they definitely need an infusion in order to keep our mail going, and also not only them, but also our hospitals in our various states that have really gone through a lot of their funding, and in order to help individuals who have been sickened by COVID-19. Now, I want to bring up this quick point with states. State budgets, the money needed to pretty much firm them back up, given the lost revenue due to tax spending and the halting of the economy in their states for the last several months in all of our states. And all states have started to reopen. But we do know, especially when we start flu season again, and we do know because of the loss of revenue, that there is going to be a deficit in every state. It really just depends on how much economic activity each state has. So those monies are very important to help shore them up. Now, there is a debate on the side of the conservative arm of the Senate where should states receive this money because there's a belief that states will use this money to pay pension obligations that they negotiated. And Mitch McConnell is a leading advocate that states should not receive this money for pension benefits because they're the ones that negotiated these pensions with their workers. Now, keep in mind that Illinois has the worst funded pension at 33%, and Kentucky, I think, is second with about 39% of it funded, which is Mitch McConnell's state, by the way. So this becomes a very interesting issue because Mitch McConnell is an advocate of states being able to file bankruptcy, the changing of the bankruptcy code. So that's an interesting discussion. As opposed to defaulting.
So Eric, break that down in real terms, for the example that you gave me about the firefighter, and what that would mean.
Sure. So there is an obscure court decision. I mentioned it before on past cases back in 2018. It's a federal case, First Circuit Court of Appeal out of Rhode Island, where it's called McGraw versus Rhode Island. And basically what happened, Cranston, Rhode Island, was basically a state that promised state pensions when they retired to their police officers, firefighters, like most do. However, Rhode Island government called for fiscal peril, and the state legislature voted unilaterally to reduce public employees' pensions benefits across the board. Now, not just for new employees, Barbara, but they made it retroactive. So that means if you're retired police officer, firefighter, or public employee, and you're getting a $2,500 pension a month for your service, it was cut down to $1,500 retroactively. So, of course, this was challenged and in the courts. However, the state, the courts agreed with the states, and they disagreed with the pension individuals, public workers who were receiving pensions. And the court stated that, in their view, a state legislature should be able to change laws even retroactively when it suits them. And it also stated that the government has no obligation to honor its promises, especially when they don't have the money to actually do it. So, this is a very recent decision. It's a First Circuit Court of Appeal decision. So the next step, of course, is the Supreme Court. But this is very interesting because now this challenges states' sovereignty to be able to change laws that benefits their state as a whole and not just a certain segment or interest group, even though it is public workers and also pensions. And one of the issues for individuals who are opponents of having states be able to file bankruptcy, which means that you have to change the bankruptcy code, is that you give over your sovereignty as a state to allow a federal judge now to basically rule over how you reorganize your state debt, as opposed to you being able to renegotiate with your creditors. And you don't want to default. A state does not want to default upon its debt because the last state to do it was Arkansas in 1933. And it was very hard for them to even borrow money up to 1939. And the last territory to file to default on their obligations, of course, was Puerto Rico, which is, of course, a territory of the United States. And it's really caused damage to their economy as well, especially with the natural disasters that they've had back to back to back.
440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Desmond joins us from Yorktown. Hi, Desmond. You're on the air.
Hi, how are you?
Okay, how are you?
I'm fine. Hey, I have a comment about the PPP. I have a local business here in the Yorktown area, and I know 4 other local black businesses that got that money. And I think those banks are kind of like dealing with people that they have a relationship with. So I'm not sure I don't know if disparities, is taken into account for all factors when it comes down to those loans. And I heard you guys talking about loan forgiveness. I don't know about that. Life is about choices, and when you make a choice to take out a loan, I think you're kind of responsible for that loan. So
we were talking about college loans for college tuition. So you're saying that should not be because you made that choice. You should not have that forgiven. That's your position.
Yeah, absolutely. Because let me give you an example. We got a whole bunch of blue collar workers that pay taxes. And we're asking them to actually pay for somebody who got a college degree. That doesn't seem fair to me.
Okay.
But,
okay. we appreciate the call, Desmond. I'm going to let Eric respond to you. Thanks so much for the call. Eric, what do you think? He says that's not fair.
Sure. So let me address the PPP program and the disparities in lending. Then I'll go into the classic argument that he gave as it relates to the common person receiving forgiveness. First of all, with PPP, that particular Paycheck Protection Program, they did find where banks were basically giving the loans to companies that they had relationships with and had the large accounts. It had left a lot of individuals who were small business owners that had lower payrolls than these larger companies, basically out in the dark. Now, as it related to African American businesses, or what we call minority businesses, or micro businesses, basically they were not even almost, if they were in the line, they were in the back of the line. And by the time they got to the door, all the money was gone. This is why in the second round, monies were now given to credit unions to work with these entities, and also Magic Johnson. He actually is working with a group in order to give loans, I think $100 million, participating in the PPP program for African American businesses. So again, the inequalities and the obstacles to these opportunities are there, and they're rearing their head, and we're seeing it. We're seeing it straightforward. Now, even in the Heroes Act, just before you move on, they're also addressing that again in terms of the fact that the monies have not
gone down to the level where the smaller businesses can benefit.
Exactly. So with that, now some companies are giving the money back because they were pretty much exposed for what they were doing. Okay, so as it relates to the second point of the caller, when saying that this is a classic argument, well, this person should not be forgiven. They made their choices. Every single day, the stock market makes decisions, and they make a lot of bad decisions investing our money. And they can go straight to the Federal Reserve and Treasury and get bailed out. It happened during the time of the backlash on Wall Street. What ended up happening is because banks got bailed out, companies got bailed out, they lost trillions of dollars. And the federal government basically said, okay, well, we'll give you X amount of billions back. And they were bailed out. And they used that money to buy back their stocks, to inflate their stock value and inflate the stock market. And these individuals are taking those additional dollars and buying additional yachts, additional places, second homes and vacation homes and things of that nature. And these are things that happen out of the purview of the common man, right? Everyday working individuals. But when it comes to an individual that's needing an opportunity to further themselves because of some decisions that they made, then now we receive this argument, no, I'm a taxpayer. Everybody's a taxpayer. Oh, no, you can't do this because I'm not getting this benefit. And overall, if these individuals are not helped, then the economy is going to sink even further. And another thing about student loans that's been uncovered is the student loan forgiveness program that was touted, especially under Obama's administration and even now under Betsy DeVos. 99% of the applications that individuals for public service that paid on time for 10 years were rejected. 99% were rejected. In addition to that, student loan companies who service student loans, by the way, it's federal money given to private companies to service, to collect interest. They basically created a mechanism where they compound the interest and get everyone to consolidate under one particular loan. So the loan becomes compound and capitalized and then accrues. So that's a whole other issue with economics to really break down compound, capitalized, and accrued interest. But let's just say it's a lot of money that's being made off of a $8,500 student loan over a course of 4 years that people use to get a degree. You end up paying about maybe $25,000 to $40,000 back.
Wow. So, Eric, what lessons should we learn from the pandemic so that we can protect ourselves economically moving forward? What's the big lesson we need to learn?
Well, first of all, I would say, number one, every single person in your personal household, you have to take stock, and I talk about this all the time. We have to take stock of our personal status and personal finances and personal goals, and understand that life can happen, and that we need to be prepared as much as possible. Now, that's on a personal level. Mm-hmm. Now, on a local and state level, we also have to do the same thing. When we have surpluses, we have to save them wisely. And we also have to look at our populations that basically are left out of the economic rebound that we have in good times. And we have to say, how can we help these individuals help to obtain not just a living wage, but also a retirement that they can be proud of, something that can pass on to their children. Because if we don't help them, then our state ends up suffering because we have increased health costs, increased social services costs, a lot of times increased public safety costs, and so forth. And on a federal level, we also have to say, listen, as a country, we've been around for 200 plus years. When I'm talking about as a country, so organized after the Constitution. Mm-hmm. And we're at a point where we have to ensure that the trust of our country, the trust of what we stand for, that people really believe it, they buy into it, and they'll be proud to stay in this country, every single one, and contribute to it because it helps everyone. Some of the perils of capitalism pushes wages down for a lot of people to where they struggle and continue to struggle. Promises that were given, they're broken, and they basically work their lives to work to their hands, as the adage says, to the bone. And at the end of their life, they really don't have much to show for it or pass on that legacy to their children. So we have to look at those areas. We have to be honest about it and address it. And we have to look at the perils of capitalism and ward against those in order for the society to continue to flourish.
Mm. I'm looking at Lisa. Do we have time for one more call? Okay. Richard joins us from Newport News. Hi, Richard. You're on the air.
Barbara, always enjoy the program.
Thank you.
I wish y'all would spend more time, whatever the subject. You guys talk about symptoms versus causes. When you look at illegitimacy, graduation rates, the big picture things. Y'all spend more time talking about symptoms, disproportionate cases of COVID and such. I don't think you're not giving the complete picture. The gentleman said taxes. Everybody pays taxes. Actually, half the people, adults, he knows all this, I'm sure, but 97% of the federal taxes are paid by 50% of the people. And these are points you guys could bring up to give a more balanced.
All right, let me let Eric respond to that. Thanks for the call, Richard. We appreciate it. Eric?
Sure. Richard, thank you very much for the phone call. One thing that we look at when we talk about what's taking place, right? So life happens. Individuals do make decisions. There are decisions that even if you do make all the right decisions, something can happen in your life and turn it upside down. Happens all the time. And as it relates to what we're experiencing during the pandemic itself, it's exposing those obstacles that individuals face in order to receive opportunities that other people receive. Case in point, there's absolutely nothing that a person in their life has done when they go to the hospital, and it takes them 3 trips to the hospital just to get the same test that their white counterparts would receive. And this is something that we haven't talked about much, but there are stories, many, many stories across the country where African Americans have gone to the hospital, they've been turned away and not treated for COVID. As a matter of fact, one of the doctors who was on the show, who's actually my sister-in-law, talks about how a Black female was turned away twice by 2 other white physicians and would not test her at all. But because she tested her, and she's a black physician, that person was found to be positive with COVID-19, and that person was then treated and her life was saved. That person didn't do anything or make any decision that hindered her from being treated fairly and equally in our healthcare system. It was because of the obstacles and the racism that does exist there. So if
I think it's hard. I think it's hard for people to understand, and especially those who don't experience it, implicit and explicit bias in terms of systems and the ability to be able to take advantage of the exact same system and be treated the same way within that system. And that's where I think the disconnect comes sometimes for some of our listeners, because they don't experience it, and so therefore it's hard for them to understand that 2 people can actually walk into a room. And I mean, one of the examples people do all the time when they were testing for renting to minorities in housing. And you would send in a white couple and a black couple and watch the difference in the disparity in the way that they were treated in terms of what was required, how much money they had to make, what kinds of things they had to fill out, et cetera. So it's the system that we're trying to get people to understand is different for different people.
Exactly, Barbara. And again, we're looking at, again, the treatment of African Americans, people of color, when they go into the exact same system. If I didn't have on my bow tie, if I didn't have on my blazer, if I didn't look like a professor or look like an attorney, and I was dressed just in my workout gear that I wear, and I go into the same store, I'll be treated much differently.
Yes.
And my white counterparts that come in looking the exact same way. This happens over and over again. And a lot of times what happens in these pandemics...
We got 30 seconds.
Okay, what happens in crises is that we tend to blame the victim. We blame the victim for everything that they've done. However, when it comes to what Paul Robinson called the most favored race, then we look at the situation and we do our very best to help them and say that it's not their fault, it's because everybody else failed them. Perfect example is the opioid addiction crisis and also the crack addiction crisis. So again, disparities are there, but again, we want to address the racial obstacles and structural inequalities to help everyone.
Absolutely. Eric, thank you so much. That's Dr. Eric Claville with Norfolk State University. Thanks so much for joining us today. We appreciate it. A Harrisonburg woman is using hip-hop to change mindsets and improve the health of some of our most vulnerable youth. Dr. P. Tondi Hicks Harper created Hip-Hop to Prevent 12 years ago. Our Lisa Godley looks at how this pop culture curriculum is engaging middle and high school students with stories and lyrics from popular artists, including 2 from right here in Hampton Roads.
Participants might really look at hip-hop as being just rap music, but I wanted to mention that it is a vast culture, and in August of 2023, hip-hop is going to be 50 years old. So it's full of traditions and worldviews and other arts that cross racial and ethnic boundaries, yes, and even political views, unlike any other culture worldwide, and it cannot be ignored in education nor help.
As an educator, Dr. P. Tondi Hicks Harper noticed early on how hip-hop was emerging and the impact it was having on her own child.
My then young son was trying to be a rapper, and I saw how it was motivating him to really tune into not only his health by way of KRS-One, who's actually a hip-hop icon, who talked about eating healthy during that time. And I said, there must be something to this.
This is another public service announcement. You can believe it or you can doubt it.
From that point on, she made a decision to spend the rest of her life trying to understand it, and she wanted to look at it from the perspective of education and health. So with the help of a colleague, she created a curriculum that would connect the two.
Within our curriculum, we actually have this whole piece called The Rhyme. And this is an area where we take the lyrics of various hip-hop artists to see whether or not what they're saying glamorizes drug use or does not glamorize drug use. So young people participate in dissecting the lyrics and actually talking specifically about what is in their best interest and what is not in their best interest.
Hip Hop to Prevent targets middle and high school students and is being used across the country in places like Texas, North Carolina, and Florida by teachers and youth development specialists. Of the many artists she uses in her teachings, 2 of them hail from Hampton Roads. She shares the story of Grammy Award-winning producer, singer, songwriter, and rapper Timbaland, who found himself addicted to opioids but overcame.
I had to realize that I'm still that guy from the country, Virginia Beach. I'm just great at music, and I felt like I was abusing my gift that God gave me. And when I was on the drugs, he took that gift away, and I couldn't hear music the same. I just really kind of recently got it back to where I can hear it.
An example of learning through lyrics is the song Hampton Roads' own Missy Elliott recorded with the Clark sisters, called I'm Not Perfect.
We've been through things, feels like we've been to hell and back.
We've been through things, feels like we've been to hell and back. And the ones you've lost, I'd give my life if I could bring them back. And your self-esteem might be low from what people say. Hold your head up high. I promise it's going to be okay. And it's so relative to what's happening right now with COVID-19, and a message like this, which we have been using as a part of our implementation of Hip Hop to Prevent Substance Abuse and HIV and AIDS, and it has resounded, which is why I'm talking about it right now, because young people have an opportunity to really speak out and not be contained.
Dr. Hicks Harper says during this pandemic, we're seeing more and more young people being quarantined and becoming stressed, anxious, and looking for ways to escape and are turning to drugs.
Even though marijuana is decriminalized or legal in various areas of the country, that doesn't mean that it's good for you. Unquestionably, it doesn't mean that it's okay for you to use. Right now, your brain is developing, and whereas it would have a different effect on an older person, for you, it is really detrimental. So our curriculum provides resiliency skills for them to use, like introducing strategies, for example, for bouncing back from feeling low, like coping strategies, whether it be meditation or mindfulness or reaching out to someone they look up to. It's an unfortunate situation, but it is the reality. It's the reality of what's happening right now, and HUP is unquestionably a solution to that.
Normally, Dr. Hicks Harper would be out in the community helping spread the Hip Hop to Prevent message through forums, youth conferences, and seminars. But during this period of social distancing, she's turning to the internet to help spread the word to young people that there are opportunities for them to both speak and be heard. For Another View, I'm Lisa Godley.
And if you'd like to know more about Hip Hop to Prevent, check out their website at hiphoptoprevent.com. And while you're online, visit our website, anotherviewradio.org, to download the Another View podcast and sign up for our eView newsletter. We're happy to report our member list is growing, but we still need you to sign up to receive a once-a-week reminder of upcoming shows, and we thank you. Next week on Another View, up close and personal with the president of Norfolk State University, Dr. Javon Adams Gaston. She'll discuss her first year as the 7th president of NSU, navigating through a pandemic, and plans for the future. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. I'm Barbara Ham Lee. Please continue to practice social distancing, wash your hands frequently, wear a mask out in public, and remember, it's safer at home. Enjoy the holiday weekend, everyone, and let's get together again next Thursday at noon for Another View.